my name is Kat Casada, and today I'll be doing the abdominal assessment on my patient. I'm going to explain the procedures to her and obtain her informed consent.
Yes.
Okay, and then I'm going to make sure I examine the painful areas last, and I'm going to start by having you lay down with your knees up. This helps relax the abdominal muscles. So first I'm going to start by examining the contour of her stomach, noting if it's rounded, protuberant, scaphoid, or flat. In this case, I would note flat. So next we're going to look at the symmetry, examining the umbilicus, noting if it's protuberant. In this case, it's not. And then we are going to look at the make sure there's no lesions, scars, striae, tattoos, piercings, and then any abnormal pulsations or movement. And then I'm going to look to see if there's any hair distribution and noting the symmetry of that. So first we're going to start by auscultating the 4 quadrants. So in this I'm going to be using the diaphragm of my stethoscope. So we're going to start with the lower right quadrant. And we're just listening for the bowel sounds. Moving to the right upper quadrant. And then to the left upper quadrant. And to the left lower. Okay, so now we're going to be listening to the vascular sounds, and I'm going to switch to the bell of my stethoscope. So we're going to start with the left femoral, to left iliac, to left renal, to the aorta, to the right renal, to the right iliac, and to the right femoral. Good. So now we're going to move on to percussing. We're going to tap lightly over the 4 quadrants. So I'm going to start on the right side. So what you want to listen for, a normal sound is tympany, and then with gas there would be hyperresonance, and over a full bladder then there would be a dull noise. So now I'm going to do a CVA tenderness. So can you sit up, please? So this is looking at the kidneys. I'm going to place one hand over her kidney and tap. Same thing for the other side. And then I would note any pain that the patient is experiencing. So lay back down, please. So now we're going to do palpation. So we're going to move on and do light palpation of the 4 quadrants. So again, I'm going to start at the right lower, right upper, and left lower. So now we're going to do the liver. So we can also do the Murphy's test at this point. The Murphy's test looks for any pain near the liver, which indicates a gallbladder problem. So first I'm going to have my patient inhale. I'm placing my hands under the right ribs, and as she inhales, I'm pushing my fingers in to feel the liver, and you should only feel like the first 2 inches. And then you would also know any pain. So next I'm going to observe the spleen and the kidneys. Spleen's on the right side, and then the kidneys you would push up and then palpate on top. Good. And then we are going to do the abdominal aorta. So this, I'm going to have my patient inhale, and I'm going to push down and pull up to see the rebound, and if they experience any pain, I would note that. And then lastly, we're going to do the iliopsoas. So I'm going to have my patient extend her right leg. Right leg. And then I'm going to have her resist against my push. Good. And if they experience any pain, that would indicate appendicitis.